Hi, and welcome to the Local Spotlight. I'm Shilpa and excited to have with me Dr. Christopher Outten with Outten Family Chiropractic. Welcome, Chris.
Thank you for having me.
It's a pleasure. So do tell us a little bit about your practice and a little bit about your background as well.
Sure. I've been in practice for 28 years altogether. I used to practice in New York for a while, and now I've been practicing in Cary, North Carolina for 25 years. I guess I'd call it a family practice. I see patients of all ages. I have a postgraduate certification in pediatrics, so I see infants and adolescents. I see adults and I see seniors for various conditions.
I see. That's wonderful to know. Can you tell us a little bit about what kind of training you need to get to become a chiropractor?
Sure. Chiropractors have to have a bachelor's degree, and usually in the health sciences, biology, chemistry, microbiology, kinesiology. Once they've gotten their bachelor's degree, they go on to doctorate school, and it's a 5 academic year program. So it is actually more class hours than a medical doctor. And within that 5 academic years, you take 4 national boards. After you've passed the 4 national boards, you sit for a state board, which is usually a jurisprudence test on the laws of the state. Once you're a licensed chiropractic physician, then you have to complete 24 hours of continuing ed every year.
That's interesting. It sounds pretty intense and very disciplined, right? So on that,
Yeah.
can you talk a little bit about the term chiropractic itself in terms of, how do you define it and what is the philosophy behind it?
Sure. I'd like to describe chiropractic. It's an art because we use our hands, we use instruments, but it's a science, but it's also a philosophy that states the body is self-healing and self-regulating. And it's your brain and your nervous system that controls everything that goes on in your body. So if the brain cannot communicate properly with the body because of physical stressors or chemical stressors, what we're ingesting or our surroundings, or psychological stressors, the body will not be able to function properly. So it's the chiropractor's job to locate those stressors, reduce them through adjusting the spine, education of the patient for their activities of daily living, sitting better, sleeping better, putting less stress on their body, nutritional education, that plays a big role in their health, and also help reducing psychological stressors. So the body can do what it's supposed to do, heal itself and regulate itself. The natural state of the human body is health.
Yes, that's very interesting to know, because most of the times when people hear chiropractic, the only thing they probably think of is somebody adjusting their spine and headaches and so on.
Right. I have back pain, I have neck pain, or I have a headache. That's what chiropractors do. And I always say to those patients, if that's all I do, I'm kind of an expensive aspirin just to get rid of a symptom. My goal is to make sure your nervous system's communicating better so your body can heal itself the way it's supposed to.
Right. So what are the typical issues you see, and what are the range of issues you see, and when does one come to see you versus go to an orthopedician?
So I'll go with the age ranges. With infants, probably the number one thing we see is ear infections and colic and reflux. And once we get their nervous system working better, the body heals itself. And what's nice about infants is they heal. I always say adults heal in weeks, months, and years, where infants heal in hours. It's amazing. It's life-changing when a parent comes in with a colic child who's been screaming for the last 3 weeks, and 1 or 2 adjustments, and the child's colic resolves. They're healing machines. They haven't had a chance to abuse themselves. Adolescents, teenagers, I see a lot of scoliosis. I see a lot of sports injuries. Lately, I've been seeing a lot of neck pain and back pain in adolescents because of the sedentary lifestyle. You know, nowadays, because of the COVID virus, these poor kids are sitting in front of a computer for 8 hours a day. Also, the use of devices. You may have heard the term tech snack, where people, you know, children are looking at the devices all day long, and they develop significant pain in their neck. Adults, I will see, you know, the weekend warriors, the people who play golf, the people who play tennis hurt themselves, people who have disc problems, chronic joint and chronic disorders. We see people with migraines, all types of headaches. And seniors, we see people with a lot of spinal and joint arthritis, and we're able to help them. So the different, you know, when would you go to an orthopedist as opposed to a chiropractor? You know, chiropractors typically don't treat fractures or dislocations, but just about any musculoskeletal condition at least can be evaluated by a chiropractor. You know, just because you walk into my office doesn't mean I'm going to treat you. My job as a physician is to determine whether your condition is of a musculoskeletal nature, and if it is it, you know, in the realm that I can treat it.
Okay, that's very interesting to know. And had I known that you know, treat infants with colic, I might have seen you years back. Because I know we went with years of medication for one of my kids that had acid reflux. And
right, you know, I always say my pediatric practice, I don't have to advertise for that, because when you get a young mother in here and you stop their child from crying and allowing them to sleep, they tell everyone they know that you need to have your child checked.
yes.
And obviously the techniques, you know, I went through a postgraduate certification for this because it's a real specialty. You know, we use the tips of our fingers when we're adjusting. It's a very mild, very specific adjustment, but it's extremely effective.
I see. So talk to us a little bit about how your practice is differentiated.
Like I see kids. A lot of chiropractors don't see a big kid population. I actually have some chiropractors that bring their own children in to see me. Okay. I have kind of a high-tech office. We do spinal decompression, which is a treatment for people with disc issues and spinal stenosis and facet syndromes. We have a laser technology, cold laser, to help with stubborn chronic problems. So we have a lot of different modalities in our office to be able to treat a variety of different patients. We do a very good job, a very thorough job. Like I say, every patient is examined. The first visit, we don't do any treatment. It's just to discern what's wrong and whether we believe you're a chiropractic case or not. And if the patients are, it'd be our pleasure to help them. But if not, we steer them in the right direction so they get the help that they need. Okay.
So when you were explaining about chiropractic, it sounds like your goal is to kind of, I understand what the symptoms are, and many times they could be manifesting in different ways. So can you talk to any examples of, you know, patients that you've treated that might have actually not had the typical symptom, and you figured that out?
Yeah, a good example. I had a woman maybe 6 months ago who came in with low back pain that ran down her leg. So sciatic pain, probably the number one condition that a chiropractor sees. We examined her, we x-rayed her. I actually sent her for an MRI, and the report came back and then a grapefruit-sized ovarian tumor. So in this case, obviously, this patient was not a chiropractic case, and we referred them out, and she got the appropriate surgery, and she's actually doing very well now. So just because you have a pain, or you have a pain that manifests itself as a musculoskeletal type pain doesn't necessarily mean it's of a musculoskeletal origin.
Okay. Are there any other examples you'd like to talk to that have benefited your patients?
Sure. Very common, we get maybe a 30-year-old woman in the office who is suffering with migraines.
Mm-hmm.
And a typical day for that individual may be, they start the day off okay, and by noon they're developing their migraine. They have to take an Imitrex, which is a migraine medication. It helps with the symptoms, but it also makes you extremely drowsy. So most of these patients have to go to bed, and 3 hours later they wake up and they feel a little bit better. Think how that type of day impacts that person's life. It affects their life, it affects their children's life, their spouse's life. So, chiropractors are in the business of getting people back to normal activity. Many people who come in, they're in a lot of pain. They've been suffering with conditions for years, maybe seeing other providers, but the other providers haven't taken an inside-out approach. The other providers may have been taking an outside-in, with invasive therapies, drug therapies, or surgeries and things like that. And even some of the older patients, they come in and they really think, boy, what kind of healing potential do I have at 70 or 80 years of age?
Mm-hmm.
And I am shocked by the human body all the time, how the body can heal itself if it starts working the way it should.
Sure, and that sounds like it's a big part of your approach, right? I mean, you're not just going to. It's
right. So we want to, like I had said, minimize the stressors in the body, because the body is supposed to heal itself. And of course, we work with the medical community all the time, because some people have reached the point of no return where their body can't regulate itself and heal itself. And there's really the application for medicine.
Mm-hmm.
So we refer out to the appropriate provider. But, we should exhaust our conservative measures before considering invasive drug or surgeries.
Surgery, okay. And to that effect, can you talk about how your laser therapy works there?
Yeah, laser has great abilities to bring down inflammation, to help with pain. But what it also does is it helps speed up the healing process. I don't know if you remember the Krebs cycle from high school chemistry. It actually speeds up the Krebs cycle, and remember the production of ATP. If someone were to go to the orthopedist or the podiatrist and have a foot fracture, and they're 3 months after their injury and it's not healing, we may do laser therapy over that fracture, and sure enough, within a week or 2, 3 weeks, the fracture's healed. We've had patients who come in who are suffering with shingles, herpes zoster, that rash that you develop. We do the laser over the herpes zoster to help with the pain and speed the healing. They've actually done studies where they had a rash, and they will do the laser over one part of the rash and not the other. And the laser area heals dramatically faster. It's really a great technology. And believe it or not, most practitioners who use a laser aren't working on humans. Most vets are using lasers.
Oh.
So I have a patient who works in a vet clinic right here in Cary, and there's a practitioner that comes in that does laser on the animals. And she says it's the craziest phenomenon. When the dog sees the laser practitioner walk in, they'll lie down and almost assume the position.
Oh my goodness. Wow.
And she says the only other time that happens is when these animals get insulin shots. And you would think, what animal wants a shot? But obviously the insulin makes them feel so much better. Mm-hmm. So I always say, when it comes to cold laser therapy, there's the proof in it of its efficacy. Mm-hmm. Because there's no placebo effect with an animal.
Right.
So I'm on a kind of a Facebook blog with all the other providers that own these laser instruments, and most of them aren't chiropractors or medical doctors or orthopedists. They're vets. So I get to see all these vet cases, and like a horse that's been injured and their wound isn't healing for months. They do the laser over the wound. Within a week or two, they take a picture of it. It's completely healed. It's actually like a miracle.
That's amazing. Now talk to us a little bit more about the spinal decompression.
Spinal decompression is for basically 3 conditions. First is a disc herniation. The discs are the little pads between the bones of the spine, the vertebra. And it's kind of like a jelly donut. When you kind of put stress on your disc for over the years because you sit for a living, or you've been in an accident, or you have some other type of injury, sometimes those discs can tear, and the jelly can go through the path of least resistance and come out and put pressure on the nerves. Spinal stenosis, where the canal for the spinal cord becomes narrowed because of arthritis or disc herniation. And the back joints of the spine become arthritic, what we call a facet syndrome. So basically, the spinal decompression is very specific to that spinal level. And it distracts that area with a certain amount of pressure, and it reduces it, distracts it, reduces it, distracts it, and eventually gives more room for that nerve to run through, and it relieves the patient's pain, and they get back to normal life without the use of surgery. It's actually very effective, but what I'm most proud of it is it's very safe. I have been doing this type of therapy for over 15 years in my office. I've never had one patient get worse. And that's pretty amazing to say about any type of therapy, that no one has gotten worse.
Okay. And is that more for chronic pain, or could it also
no, it's, some people have been in acute injury, but a lot of people who've had chronic back pain, they have sciatica, or they have radicular pain in their arm. We come in and we make sure that we examine them and look at all the studies. Most of these people are not coming right off the street into my office. Most people have been to the orthopedist, they've been to the neurologist, they've had spinal injections, they have oral steroids, and nothing's working. And then they finally recommend surgery. And then they look for alternatives, and that's when they walk into my office and they heard about the spinal decompression and that it could prevent surgery. So my job initially is to examine the patient, look at all the studies, and make sure they're an appropriate candidate for that therapy.
Okay, that's very good to know. And so you also work with, I'm sure, physical therapists, occupational therapists, and so on. Can you talk a little bit about your network?
Sure. Like I said, some people reach the point of no return. So in my office, because I do spinal decompression, we send out some people for surgery because they're not responding. So we work with surgeons, and we work with surgeons who are very conservative, will do the least invasive type surgery to get the job done. We work with, a lot of sports injuries that aren't responding, people who have maybe labral tears in their shoulder or in their hip that's is not going to heal by itself. We send them out for surgery. And, I've been in practice in Cary for 25 years, so I really know all the good providers out there. We work with physical therapists because, because of time constraints, we're not able to maybe rehab the patient and work with exercise where a physical therapist can spend more time, or an occupational therapist can spend. And we also refer out to alternative providers. I refer out for acupuncture. I refer out for Ayurvedic medicine. I also refer out for nutritional counseling, things like that.
Okay, that's good to know. So you're very experienced and been around in the industry for many years. You're also on certain chiropractic boards. So can you tell us a little more about those?
Yeah, the first board I was on was the North Carolina Chiropractic Association.
Mhm.
And that's the group that protects the chiropractic scope of practice. They educate the providers in the state. They provide seminars and things like that. Um, and I did that for 13 years, and I was the president of the association. I'm currently the vice president of the North Carolina Chiropractic Board of Examiners, and that's the regulatory board. That's the board that will provide education, but also license the doctors and also discipline the doctors who are doing things inappropriately.
Okay.
And that's actually appointed by the governor.
Oh, okay.
Those positions.
So it's very good, very informative. So how have we been dealing with the pandemic right now?
Yeah, we've never been closed. Speaking of the governor actually asked chiropractors not to close because he wanted to steer the musculoskeletal cases away from the ER and away from medical facilities to reduce those patients' exposure to the virus. So, initially we worked half days because our volume of patients decreased, but eventually we did that only for a month. After a month, we were back to normal hours. Okay. And we're at normal volume patient-wise right now. But, when you walk into the office, we have hand sanitizer that you use. Everyone's wearing a mask, not only the staff, but the patients are wearing a mask. We have interview questions. The tables are sanitized before and after the patient's using it. Everybody's washing hands. We're following the CDC and the WHO guidelines for chiropractic.
Sure. Well, this was a lot of good information, Chris. It's really good chatting with you, and thank you for being here. And
thank you for having me. I love talking about what I do, and I love talking about chiropractic. My son is actually studying to be a chiropractor, so I'm very excited. In a couple of years, I'll be able to practice alongside my son. So, yeah.
That sounds great. Clearly your passion is coming through. So we'll definitely put out all your information out there, and folks feel free to check it out. And thank you for watching, and do stay tuned for more episodes of the Local Spotlight. And if you're not watching from within the group, we do have a Facebook group called Localista, where we promote and connect local businesses, artisans, events, and bring together community efforts. Thanks, everyone.